A hidden medical scandal unveiled, the fight for justice over a toxic pregnancy drug. Imagine being prescribed a medication meant to protect your unborn child, only to discover decades later that it caused irreversible harm. This is the devastating reality for thousands of women and their families who were exposed to diethylstilbestrol, DES, a synthetic hormone now linked to rare cancers and infertility. But here's where it gets even more shocking. Despite warnings emerging as early as the 1970s, DES continued to be prescribed to pregnant women in the UK until the 1980s, leaving a trail of suffering that spans generations. Now, after a groundbreaking ITV News investigation, survivors are demanding answers, accountability, and justice. The scale of the scandal. DES, dubbed the hidden thalidomide, was administered to an estimated 300,000 women through the NHS between the 1930s and 1980s to prevent miscarriages and other pregnancy complications. However, it wasn't until years later that the drug's sinister side effects came to light. Daughters of women who took DES, known as DES daughters, face an increased risk of rare cancers like clear cell carcinoma of the cervix and vagina, conditions that routine screenings often miss. Mothers who took the drug also face a 30% higher risk of breast cancer. The intergenerational impact of this medical disaster is staggering, yet it remains largely unrecognized by the healthcare system. The human cost, stories of guilt, pain, and loss. Take the story of Mary Stewart, 83, who was prescribed DES in 1966 after multiple miscarriages. Her daughter, Helen Scanlon, now 58, has endured a lifetime of health issues, including a misshapen womb, cervical cancer, and chronic pain. "I'm devastated that I haven't had a family of my own," Helen told ITV News, her voice trembling with emotion. Mary, haunted by guilt, wishes she had never taken the drug. "I've regretted it ever since, but I can't turn the clock back," she said. Their story is not unique. Hundreds of women like Mary and Helen are now banding together under DES Justice UK, demanding a public inquiry and compensation for the decades of suffering they've endured. And this is the part most people miss. The Medicines and Healthcare Products Regulatory Agency, MHRA, admitted last month to misleading the public for 25 years about when DES was withdrawn. They falsely claimed doctors were advised to stop prescribing it in 1973, when in reality, it remained in use until the 1980s, over a decade after its cancer risks were known. This staggering regulatory failure has left survivors feeling betrayed and abandoned by the very institutions meant to protect them. The fight for accountability. In a significant move, Health Secretary Wes Streeting has asked NHS England to work urgently with local cancer alliances to ensure GPS are aware of DES's impact and to provide additional screening for those at risk. But is this enough? Campaigners argue that a statutory public inquiry is long overdue. It's a national disgrace that victims have been ignored, disbelieved, and humiliated, said Claire Fletcher, a lawyer representing DES survivors. These women deserve the truth and the compensation they've been denied for so long. Controversial questions that demand answers. Why did it take so long for DES to be withdrawn, despite clear evidence of its dangers? How many more lives could have been spared if health authorities had acted sooner? And perhaps most controversially, are we doing enough to prevent similar scandals in the future? The lack of awareness among healthcare professionals about DES is alarming. As Labour MP Sharon Hodgson pointed out, GPS are literally Googling ITV News coverage to find out what this is. This raises serious questions about the education and training of medical professionals in recognizing and addressing historical medical scandals. What happens next? Survivors and advocates are calling for a multi-pronged approach, a public inquiry, an information campaign for healthcare professionals, targeted medical research, and a compensation fund. But the fight doesn't end there. We need to ask ourselves, how can we ensure that no other generation suffers in silence like the DES survivors have? Share your thoughts in the comments. Do you think the government's response has been adequate? What more should be done to support the victims and prevent future scandals? Let's keep this conversation going, because justice delayed is justice denied. Resources and support. Information on DES exposure and cancer, https://www.cancer.gov/about-cancer-risk/hormones/des-fact-sheet. Des Justice UK campaign page, https://www.jacksonlees.uk/des-justice-UK. NHS information on cervical cancer, https://www.nhs.uk/conditions/cervical-cancer/causes, and breast cancer, https://www.nhs.uk/conditions/breast-cancer-in-women. If you or someone you know has been affected by DES, you can share your story by emailing socialaffairs@itv.com. Together, we can amplify these voices and demand the justice they deserve.